So hello everyone, welcome to Great Online Training. So today we're going to start with ICD-10-CM coding guidelines for Chapter 20. Chapter 20 is about external causes of morbidity and code ranges are V002 to Y99. Okay, and we have to use these external causes with injury codes, okay, which is caused because of some external forces or any external cause. We have to specify that external cause, and for that we have to use V002 Y99 series. How to use this we'll see in this session. So topics covered in this class are introduction, ICD-10 coding guidelines like general external cause coding guidelines, place of occurrence guidelines, activity codes, place of occurrence, activity, status code used with other external cause code. Then we have if the reporting format limits the number of external cause codes, how to code that. Then multiple external cause coding guidelines, child and adult abuse guideline, unknown or undetermined intent guideline, sequelae or late effects of external cause guideline, then terrorism guidelines and external cause status codes. Okay, and lastly we'll see how to solve the question and answers. Okay, so what are external causes? Reporting external causes of morbidity is important because wounds, injuries, poisoning, and adverse effects of medications require reporting of the circumstances around them as the cause may be varied. Okay, when we code for any wound, injury, or poisoning and any adverse effect of any medication, we have to use external cause codes as a cause of that injury. Or the external cause codes identify the cause of an injury or health condition. The intent means accidental or intentional. If poisoning is there, then what is that? What is intent of that medication? That is accidental or intentional. Or the place where the incident occurred, the activity of the patient at the time of the incident, and the patient status, such as civilian or military, that we can specify using the external causes, external cause codes. ICD-10 external cause codes V002 Y99 are secondary codes that capture specific details about an injury or health event. Yes. So topics cover means we have 11 subchapters in chapter 20. Okay, like V002 X50 course we have to use for coding accident related external causes. Okay, means motor vehicle accident and everything will get codes for that in V002 X58 course code range. X71 to X83 is for intentional self harm, like if it is something related to suicide. Okay, X92 to Y09 is related to assaults. Then Y21 to Y33 events of undetermined intent. Y35 to Y38 is for legal intervention, operations of war, military operations, and terrorism. Then Y62 to Y84 is for complications of medical and surgical care. And Y90 to Y99 is for supplementary factors related to causes of morbidity classified elsewhere. Okay, so these types of code range is there in this chapter. So first point in coding guidelines means ICD-10 coding guidelines. A point is general external cause coding guidelines. First point is used with any code in the range of A00.0 to T88.9 and Z00 to Z99. Okay. So an external cause code may be used with any code in range of A00.0 to T88.9 and Z00 to Z99. Classification that represents a health condition due to an external cause. Okay, so any health condition cause because of external cause. Okay, we can use this external cause code with that condition. Okay, and any health condition we coded from category A00.0 to T88.9, right? So we have to use this external cause code any health condition related to or cause due to external cause. They can be reported with any condition due to an external cause and are not limited to injuries or poisoning such as heart attack that occurs during strenuous physical activity. Okay, like that. Means external causes are not just limited to injury or poisoning. We can use external causes with any kind of condition. But just one thing that our physician or in or on question, it has to be mentioned that this condition is caused because of some physical activity or some external force or something. In that case, we have to use external cause codes. Example: patient admitted with cellulitis due to insect bite on pig. Okay, here you can see patient had cellulitis, and that is because of insect bite. Okay, so we have to code cellulitis. How to find out this code for cellulitis, that we'll see later on. Okay, right now we focus on just this external cause code, which is W57.XXXA. So it is bitten or stung by non-venomous insect and other non-venomous arthropods. Initial and okay, how to find out this code? I will show you. To find out the external cause code, you can see here we have same structure in book also. Okay, if you when you go through your book, you can see first normal index, okay, which is used for diseases. Okay, and then we have another index which named as external cause index. Okay, and to find out the external causes, we have to follow this index, external cause index. If you are not right now not able to use your books, you can go through this site and start your practice. Otherwise, you will forget these things. So we need code for insect bite, right? So we have to search for bite under the external cause index. Please remember this external cause index. This is not regular external cause index. We have to search for V and bite. So this is bite or bitten by. Click here and search for, as this is insect, we have to search for insect. We got the term insect. Okay, we got category W57. Okay, if we click W57 in the book, once you get the W57 number, you have to go and search in the tabular list. Okay, that I'll show you how to search. Now, in W57 we have three codes. Okay, W57 XXXA, W57 XXXD, W57 XXXS. Okay, so what is meaning of this A? So what is A and all that we'll see in another sessions. Okay, now just focus on this category. Okay, which is starting letters W57, which is used for bitten by. You can see here bitten or stung by non-venomous insect and other non-venomous arthropods. Used for initial encounter. D is used for subsequent encounter. Okay, and S is used for sequela. So right now this is initial encounter. Okay, that's why we have to use this code W57 XXXA. And you can see synonyms here: cause of injury, non-venomous arthropod, insect bite. Okay, on different location, can use same code. So many synonyms are for the same code. Clear? Any doubt?
Yeah, no, it's good.
Sometimes we get specified external cause code. So first we need to go and see details of that code. Okay, whether we have specific code or not. Next point, external cause code used for length of treatment. So assigning the external cause code with the appropriate seventh character for each encounter for which the injury or condition is being treated. Okay? Like just I show you that each and every most of the codes ends with A, D, and S character. Right? The seventh character A, D, and S. So A represent initial encounter, D is for subsequent encounter, means each encounter after initial encounter. You have to use D code or D letter, D seventh letter. Then if any sequela or after effect or late effect of that injury is there, in that case we have to use S as a seventh. Okay. So next point, use the full range of external cause codes. Use the full range of external cause codes to completely describe the cause, intent, place of occurrence, and if applicable, the activity of the patient at the time of the event. Okay, and the patient status. So each and every time this activity and patient status or place of occurrence, these three things, each and every time physician not mentioned. Okay, or in your patient it is not, it may be not present. At that time you no need to code them. Okay, if it is documented you have to code for it. Okay, but most of the time external causes will be there, okay, which causes that particular injury. Or so next point, assign as many external cause codes as necessary. Multiple external cause codes may be used to fully explain each cause. Okay, sometimes many external causes some injury or wound. At the time you can code or use multiple codes to fully explain that each cause. If only one external cause can be reported, use code most related to the principal diagnosis. Principal diagnosis means which actually reason for encounter. Okay. So if you have multiple cause codes, okay, multiple cause external code, but in your report, means your company is you are using, companies will use billing software, right? So you have limitation of using codes. You can use 5 codes. Again, some companies allow to use 5 codes, some needs 10 codes. So if you have limitation of using external cause code, in that case you have to use only one external cause code, which is most related to principal diagnosis, which is most related to reason for it. Next point, the selection of the appropriate external cause code. The selection of appropriate external cause code is guided by the alphabetic index of external causes and by inclusion and exclusion notes in the tabular list. The external cause code can never be a principal diagnosis. This is very important point. Okay. As if you are fresher, this is you have to note down this term or this point. An external cause code can never be a principal diagnosis or first listed diagnosis. Each and every time we have to use some injury code or any health related condition code as a primary code. After that, we can use external cause code. You can't use these codes as a principal diagnosis. Means at the first. Okay. Next, combination external cause codes. Certain of the external cause codes are combination codes that identify sequential events that results in an injury, such as fall, which results in striking against an object. The injury may be due to either event or both. Okay, so we have codes like fall with subsequent striking against object. Okay, so we have combination external cause codes also. The combination external cause code used should correspond to sequence of events regardless of which caused the most serious injury. Okay? No external cause code needed in certain circumstances. No external cause code is necessary if the external cause and intent are included in a code from another chapter. Some chapters already included external cause and intent into the code, into the like for example T36.0x1, okay, poisoning by penicillin, and it says intent is accidental, means unintentional. Okay, so it already, this code is only including the intent, so we don't need to code it separately. using external cause. Okay, clear? Do you have any doubt?
I don't understand this example. The example itself has the code you are saying, is it?
Yeah, this is code for poisoning. Okay, poisoning codes we can find in T series in next sessions. Okay, further sessions we will cover this chapter of poisoning, adverse effect, and everything. But here is saying that if the code itself covered the intention, here you can see this code is covering the intention that this poisoning is accidental, right? So we don't need to use extra external cause code. Okay, as it is included in this code only, in this poisoning code only. Getting it?
Yeah, okay.
Yeah.
I got it.
So next, place of occurrence guidance. Place of occurrence code should be reported after other external cause codes. Okay, so we'll see how to sequence these external cause codes, place of occurrence codes in further slides. But place of occurrence code should be reported after other external cause codes. Place of occurrence code is used only once at the initial encounter. This is also important point. You have to use place of occurrence code only at the first time of the encounter. It means at the initial encounter. For patient, you have to use this only at once for treatment and do not have 7 character. That's why these codes do not have 7 character. Remember, I told you insect bite ended with A, D, and S character. Because external cause code we can use in subsequent encounter and on sequela condition also. But this place of occurrence code we have to use only once at the initial encounter. After that, there is no need to code this. Okay. So place of occurrence codes looks like something Y92.8. So these codes don't have 7th character. Do not code Y92.9 unspecified place or not applicable. Okay, if the place is not specified or it is or is not applicable. So means if, as just I told you, if place of occurrence or activity codes, if any documentation is not there in your example means question or in your patient's report, if physician not documented place of occurrence, in that case you no need to code it. Okay, you should not use this unspecified code. If place of occurrence is there, you can code it. Otherwise, leave. Okay, no need to code it. Clear? And you have to use place of occurrence code only once at the initial encounter. These two important guidelines here.
Okay.
Clear?
Yeah.
Next, activity code. You can see this is also 5th character Y93G3, something related to kitchen, right? So assign a activity from category Y93 activity code to describe the activity of the patient at the time of the injury or other health condition. We can use activity codes Y93 and show you how to find out this code. Now we are saying external cause codes. So always we have to use this second option. Okay, external cause index and to search for activity. If you go in activity term, you can see so many activities are there. Alpine skiing, animal care, art and handcrafts, bullet, baking, bathing, bike riding, so many activities are there. So you have to choose your code from this. Most appropriate code you have to choose. Okay, related to water, aerobics, craft, exercise, polo, skiing, even wading is also there, yoga, treadmill. So if your physician mention documented activity of that patient during that injury or any health related condition, you have to code that using this codes, which you can find when you go in external cause index and search for activity. Under the activity, you can find this codes, all this code, okay? And place of occurrence code you can find here. In the same index, external cause index, you have to go on P term and search for place of occurrence. Please note down these steps and follow the same in your books.
Okay, yeah, I'm doing that.
External cause index, then search for place of occurrence. You can get all the codes for place of occurrence like beach, boat, bridge, cafe. We have so many external cause codes. Sometimes you get amazed. This we have code for this condition also, and all. If you go through internet, you'll get so many memes and all related to this external cause codes. Means external cause related to Halloween, external cause related to Christmas or any other day. Day specific external causes are also there. You can find it. Okay, this is clear how to find the external cause code for place of occurrence and activity. Or should
Yes.
I? Yeah.
Yeah, I'm good. I
Okay.
understand.
So, an activity code is used only once at the initial encounter for the treatment. Only one code from Y93 should be recorded on the medical record. So, this is same guidelines like place of occurrence. Okay, we have to use only once at the initial encounter. That's why it also don't have 7 characters. The activity codes are not applicable to poisoning, adverse effects, and misadventures and Sequela. Okay. Do not assign Y93.9 unspecified activity if the activity is not stated. This is also same as place of occurrence. If it is not mentioned, do not assign the code. You don't need to use this code Y93.9 unspecified activity. Because in other condition, other health related condition, if we didn't find any code related to some condition, we have to use unspecified. Okay. But in case of place of occurrence and in case of activity code, we don't need to use unspecified activity or unspecified place of occurrence code if it is not mentioned or if it is not documented. The activity or place of occurrence is not documented, you don't need to code it. Okay, and you have to code them both the types of code at the initial encounter. Next point, place of occurrence activity and status code used with other external cause code. When applicable, place of occurrence, activity, and external cause status codes are sequenced after the main external cause codes. Okay? Main external cause codes means, as just we saw, insect bite. That is main external cause code. Okay, and if in that scenario, if it is mentioned that activity of that patient during that time or place of occurrence, we have to code it. But we have to use code for place of occurrence and activity after the code for insect bite. Okay. Generally, there should be only one place of occurrence code, one activity code, and one external cause status code assigned to an encounter. Okay. So we can use multiple external cause codes like insect bite or fall and something, but generally we should only use one external cause code for place of occurrence, activity code, and for external cause status code. Status code we learned yesterday. Okay, those are status codes. However, in the rare instance that a new injury occurs during hospitalization, an additional place of occurrence code may be assigned. In rare instances where new injury occurs during hospitalization, in that case, we can use additional place of occurrence code. Okay? When the responsible consultant has documented in the medical record that a condition is hospital acquired. Okay, if any condition is acquired, we have to use code Y95.X. Please note down this code because you have to remember this code. If any condition is hospital acquired, you have to use code for Y95.X. Nosocomial condition must be assigned directly after the code for the condition that has been documented as being hospital acquired. Okay, we'll see example, but please note down this code Y95.X nosocomial condition, and in the bracket you have to make a note hospital acquired condition. So example, elderly patient with documented diagnosis of intracerebral hemorrhage and a hospital-acquired deep vein thrombosis, also known as DVT. DVT means deep vein thrombosis of the left leg. Here, physician is already mentioned that the patient is diagnosed with intracranial hemorrhage. Okay, and he is admitted, and now he has hospital-acquired DVT of left leg. Okay, so we need 3 codes. First, to code intracerebral hemorrhage. How to find this code? That we'll see later on. I-61.9, which is for intracranial hemorrhage, and I-80.2, phlebitis and thrombophlebitis of other deep vessels of lower extremities. Means this code is for DVT. This first code is for intracerebral hemorrhage. Okay. Now our focus is on this third code, Y95.X, which is for nosocomial condition. Why we use this code? Because our physician is documented that this DVT is hospital acquired. Okay, that's why we have to use Y95.X code. Next, if the reporting format limits the number of external cause codes, that can be used in reporting clinical data, report the code for external cause, for cause or intent most related to the principal diagnosis. Then I have previously also explained this point. Okay, if while you are doing job, you are working as a medical coder, if your software means your company's software have limit of assigning codes. Okay, you have to, and you have so many or multiple external cause codes or intent codes. You have to use most related external cause code to the principal diagnosis. Next point, multiple external cause coding guidelines. The first external cause code should correspond to cause of most serious diagnosis due to an assault, accident, or self-harm, following the order of hierarchy listed above. If 2 or more events cause separate injuries, an external cause code should be assigned for each cause. Okay? The first listed external cause will be selected in following order. This is order for if 2 or more events cause separate injuries. In that case, you have to follow this order. First, we code for child and adult abuse. Okay. Second priority will be terrorism. Third, cataclysmic events. Then fourth, transport accidents. Fifth, activity and external cause status codes are assigned following all casual or intent external cause code. Okay? So this is sequence if 2 or more events cause separate injuries. For separate injuries, we have to code separate. We have to use separate external cause codes also. So our first priority will be any of these suppose two external cause codes causing the injuries, separate injuries. If adult abuse is there, plus transport accident is also there. In that case, first we need to code adult abuse, and then we have to use code for transport accident. Okay, so please remember this sequence. First, child and adult abuse. Second, terrorism. Third, cataclysmic events. Okay, because in yesterday also we saw, okay, the sequencing is very important in the medical coding. So when we go for certification examination, they give tricky questions, tricky options in which they shuffle the sequencing of codes. Okay, so you have to remember this sequencing. First, child and adult abuse. Second, terrorism. Third, cataclysmic events. Fourth, transport accident. And fifth, activity and external cause status codes. So, child and adult abuse guidelines. Adult and child abuse, neglect and maltreatment are classified as assault. Okay, so adult and child abuse or neglect and maltreatment are classified as assault. For confirmed cases of abuse, neglect and maltreatment, when the perpetrator is known, the code from Y07, perpetrator of maltreatment and neglect should accompany any other assault cause. Okay, if we know the person who is responsible for that assault or maltreatment and neglect, we can use Y07 code plus other assault code. Next, unknown or undetermined intent guidelines. If the intent means accidental or self-harm or assault of the cause of an injury or other condition is unknown or unspecified, code the intent as accidental intent. This is also important guideline. If the intent means intent is accidental or self-harm or assault is not mentioned or is not unknown. Okay, our physician is not documented there. In that case, but we have to select the code, which are options like accidental intent or self-harm intent, but we don't have any specification about the intent. In that case, we have to select accidental intent code. This is default. Accidental intent is default when you don't have any information about the intent of that cause. All transport accident categories assume accidental intent. And in case of transport accident, we have to code them as accidental intent. I'll show you intent. Next, use of undetermined intent. External cause code for intent for events of undetermined intent are only for use if the documentation in the record specifies that the intent cannot be determined. So we have different codes which specify intent. Either it can be accidental or self-harm or assault, or we have codes for undetermined intent also. So when we need to use undetermined intent code, when record specifies that intent cannot be determined. Okay, if this specific note is there in your documentation or in your question, in that case you can use undetermined intent. Okay, just give me a minute. You can see here in this screen codes for undetermined intent. Okay, we have separate category for undetermined intent. We start with Y21. Okay, Y21, and it is end up with A, D, and S. Again, undetermined intent. If it is accidental, we have separate category for it. Okay. In case of poisoning, you can see accidental. I'll show you. Okay. Poisoning, it is already mentioned accidental intent is there. Here intent is not mentioned. There is not required intent. But in case of means poisoning or something related to any medication which cause poisoning, we have intent code. Okay. So you have to remember that if the intent is not mentioned in your documentation, means accidental self-harm or assault is not mentioned, in that case you have to select accidental intent code. Okay. But if this particular note is there, the intent cannot be determined, like this documentation is there in your report or in your question, you have to select undetermined intent codes. Okay. And we have separate category for undetermined. Next point, sequelae or late effects of external cause guidelines. Sequelae external cause codes. Sequela are reported using the external cause code, okay, with the 7th character S, which is for sequela. S we have to use to represent sequela or late effect. Okay. These codes should be used with any report of a late effect or sequela resulting from a previous injury. Okay. So we have to use this 7th character S. I already showed you that we have separate so many codes which ends with 7th character S, which represents sequela. We have to use those codes when any report of late defect or sequela resulting from previous injuries. Next point, sequela external cause code with a related current injury. The sequela external cause code should never be used with a related current nature of injury. Okay. If sequela is there, the sequela external cause code is external cause code which has 7th character S, that we should not use with current injury. Okay. Use of sequela external cause codes for subsequent visits. Use a late effect external cause code for subsequent visits when a late effect of the initial injury is being treated. Do not use a late effect external cause code for subsequent visit for follow-up care, because if follow-up care is there, means for example to assess healing or to receive rehabilitative therapy. In that case, for follow-up care, we have D character. Remember, we have three types of 7 character: A, D, and S. Okay. A represent initial encounter. D is for subsequent or follow-up encounter, and S is for sequel. Okay. So for follow-up care, we have to use D as a 7 character, and for sequela or late effect, we have to use S as a 7. The next, terrorism guideline. First guideline: cause of injury identified by federal government (FBI) as terrorism. When the cause of an injury is identified by federal government (FBI) as terrorism, the first listed external cause code should be a code from category Y38. Y38 category is for terrorism. Okay? The definition of terrorism employed by the FBI is found at the inclusion note at the beginning of the category Y. See Y38. Okay. You can see here. These codes are for use to identify injuries resulting from unlawful use of force or violence against person or property to intimidate or the civilian population and everything. Okay, so we have definition for it also. Use additional code for place of occurrence Y92 from Y92 category. More than one Y38 code may be assigned if the injury is the result of more than one mechanism of. So if injury is caused because of more than one type of mechanism of terrorism, you can use more than one Y38. Next, cause of an injury is suspected to be result of terrorism. When the cause of an injury is suspected to be the result of terrorism, a code from category Y38 should not be assigned. Suspected cases should be classified as assault. Okay. So if it is confirmed by federal government, in that case only we can use this Y38 terrorism code. If that injury is caused, the cause of injury is suspected to be result of terrorism, we have to code it as assault. But if it is confirmed that that particular injury is caused because of terrorism, we have to use Y38. This is also important. Y38.9 terrorism secondary effects. Okay. Assign code Y38.9 terrorism secondary effects for conditions occurring subsequent to the terrorism event. This code should not be assigned for conditions that are due to the initial terrorist attack. Okay. So if terrorism secondary effect is there, we have to use Y38.9. External cause status. The code from category Y99 external cause status should be assigned whenever any other external cause code is assigned for an encounter, including an activity or to indicate the work status of person at the time of the event occurred. Okay, we have to use external cause status code, which is from category Y99, to explain work status of the person at the time of the event occurred. The external cause status code are not applicable to poisoning, adverse effects, misadventures, or late effects. Okay. External cause status code are not applicable to poisoning and adverse effects, misadventures, or late effects. An external cause status code is used only once at the initial encounter for treatment. So, till now we learned that place of occurrence, activity code, and external cause status code. All the three types of codes we have to use only once. Okay? All the three types of code we have to use only once at the initial encounter. Only one code from category Y99 should be recorded on in medical record. Do not assign Y99.9 unspecified external cause status if status is not stated. So all these three guidelines are same as previous, as we saw for activity code and place of occurrence code. All the three types of code we have to use only once at the initial encounter, plus only one type of code, only one code from that particular category we have to use to record it on medical record. Okay. Plus, if it is mentioned in report, we have to code that. We don't need to use unspecified code for it. Okay. I'll show you Y99 series. Y99, civilian activity done for income or pay, military activity, volunteer activity, other external cause status, unspecified external cause status. We have this code, but we should not use this code if activity is not mentioned. Sorry, status of external cause status is not mentioned. We should not use this code. Okay. You can get this. These are the steps to get external cause status codes. You have to go on external cause index. Then you have to search for status of external cause. Please note down these steps. External cause index, and then you have to search for status of external cause. You will get Y99 series and so many activity codes. We don't have so many options. Few options are there. Student activity, volunteer activity, specified, recreation, military activity, leisure activity, hobby not done for income, and so few options are there. So you have to choose from it. If it is documented in your report, otherwise no need to code it. And you have to use this codes only at the initial encounter. Okay. These are important rules to code external causes, or you can say summary of the whole session. Never use as primary codes. External cause codes you should not use as a primary diagnosis. Okay. Please remember all these points. Okay. If the external cause and intent are included in the code from another chapter, no external cause code from chapter 20 is necessary. For example would be OD of overdose of drug due to accidental ingestion. In most of the poisoning or overdose condition, intent is already included in the code only. Previously, I showed you example also. Okay, so in that case, you should not use external cause additionally. Place of occurrence and activity codes are typically only reported on initial encounter for treatment. Okay, we have to add one more. Just give me a minute. I add one more point here. Now it is correct. Place of occurrence, activity, and status codes are typically only reported on initial encounter for treatment. Do not code unspecified place of occurrence or activity or status code if the place or activity or status is not specified or is not documented. Okay. So these are 4 important points related to external cause. What are those? You should not use external cause code as a primary, principal, or first listed diagnosis. And if external cause and intents are already included in code from another chapters other than chapter 20, it is not necessary to use external cause code additionally. Okay. Then place of occurrence, activity and status codes are typically used or reported on initial encounter for treatment, and do not code for unspecified place of occurrence or activity or status code if place or activity or status is not specified or not documented. Okay? So these are 4 very, very important points regarding external cause codes. And remember this IPAS for sequencing code from chapter 20. Okay. When you assign for external cause, okay, you have to follow this sequencing. First, you have to code external cause for injury specific external cause, such as external cause code for fall from one level to another, or insect bite, okay, or motor vehicle accident, like that. Then we have to code for place of occurrence, external cause code if stated, okay, or if documented. Then we have to code for activity of the patient, okay, and then we have to code for S means status of the patient, such as civilian, military, etc. Okay, so this slide is very, very important. There's summary of a whole session. This is 4 important points. And again, these are also, remember the sequencing. When you sequence for external cause, you can rule out options, multiple choice options using this sequencing. Remember this IPAS. I for injury, then we have to code for P for place of occurrence, then A for activity of patient, and S for status of patient. Okay, you should follow the same sequence. Clear? Any doubt?
Yeah, no, good.
So now I have given you one scenario. While swimming in a lake near his cabin, a man hit his head on a rock, resulting in a concussion without loss of consciousness. Okay, so this is the scenario on which I will ask you. We will solve 4 questions. First question: what is external cause code used to report this injury? Okay, I have given rationale here. Refer to the external cause of injury index and refer to the main term striking against subterm objects like stationary. I'll show you how to find out this code. Okay. Main external cause, what happened here? The patient is swimming, right?
Yeah.
And then he's striking against some, where is that rock? To search for striking against. To go here in external cause index and search for striking. Then he's striking against
Swimming.
no, he's striking against rock, right?
Okay.
Swimming is the activity. So we have to search for object. Striking, object, and we have so many options under the object also. But as this is rock, this is stationary. We have to select this code. Clear?
Okay.
As this is rock, this is stationary. Sometimes you have to go think like that. Okay, and search for the code. Search for rock. That's why we have selected object, striking against object. Please make note down the steps.
Yes.
External cause code. Then we have to search for hit or striking against, and then we have to search for object. And under the object, we have to search for stationary. What this code? That is called W22 09XA, as this is initial encounter. Okay. If it is subsequent, we have to use D, or if any sequela has happened later on, then we have to use XS as the 7th character. But right now, this is our code W22.09. Okay, so correct option is B.
Okay.
Next, what is place of occurrence code used to report this injury? The answer is C. Y92.828. Okay. Here, what is the place of occurrence? Lake. Lake near each cabin. So we have to search for to find out place of occurrence. We have to go again in external cause index and search for place of occurrence. Okay, and if we search for lake, okay, we have this, but we have to select this code. Second one, other wilderness area as a place of occurrence of the external cause. Swamp, mountain, marsh, prairie as the external cause code. We have to go in place of occurrence and then search for lake, and we have to select the second option, wilderness.
Why we have to select the second option?
This is the rule.
Okay.
So you have to remember this. You should not. Okay. This is the code for lake. You can remember this code. Okay. Whenever you came across lake as a place of occurrence, you have to select this.
Okay.
Okay. So next is third question regarding this same scenario. What is the activity code used to report this injury? What is the activity here? Swimming.
Yeah.
Okay.
We have to do the activity and then swimming.
Activity and swimming. This is also straightforward.
Yeah.
So I'll show you.
Yeah. Activity and swimming.
Okay. 593.11. Here how to find came across this code, external cause index, then activity, then swimming.
Yes, I got it.
The next question, what is the status code used to report this injury? Your status is, this is some leisure activity, right? We have to again go on external cause and search for status, okay? And then leisure activity. You have to select most appropriate code from these options. Related to volunteer, if volunteer it is mentioned, student, it is not like that. Off duty, military. So
why it is leisure activity? So the swimming is considering as leisure activity.
applicability activity not elsewhere classified. If you can find your activity here, you can use this code for leisure activity. Okay. And you have synonyms applicable to hobby not done for income. So swimming is something like hobby, right?
Yes, I got it.
Yeah. That's why we have to use leisure activity. So that's it. The question and answer. Okay. This is how you have to select place of occurrence, activity code, and status codes. And remember this previous slide.
Yes.
Okay. This is very important in all the session.
I will go through this again. Yeah.
Okay. Thank you for your attention and thank you for attending this class. Bye bye. Take care.
Thank you.
Thank you.